All right. Welcome, everybody. It's 12 o'clock, so we'll go ahead and get started. Thank you for joining us today. This is the seventh session of the fourth series of the Pediatric PPCL Echo program. My name is Lena, and I'll be coordinating today's session. We'll go over a few housekeeping items before we get started. Here's a look at our agenda for today. We're going to do our best to adhere to this schedule. After the housekeeping announcements, our facilitator, Dr. Olivier, will lead us in introductions. But first, I'll tell you guys a little bit about PPCL. Then we'll pass it on to Dr. Mayer, who will then present our didactic for today. We will then move on to our case presentation that'll be presented by Margaret Smith, LCSW BACS. And after Margaret presents, we'll open the floor for clarifying questions, first from all of you guys as participants, and then we'll hear from our hub team. And once all those questions have been answered, we'll go ahead and start providing those recommendations for the case. We'll then briefly summarize all those recommendations, and after that, we'll wrap up with announcements and close our session for today. So I wanted to quickly tell you guys a little bit about PPCL. We are a no-cost mental health consultation program available to pediatric and perinatal providers across the state of Louisiana. So providers can call us to get mental health support for your patients or clients. We have psychiatry on contract that we can link you to speak about your patient, either diagnostic questions, medication management questions. We also provide resources for your patients or clients, and we also offer webinars such as this and others throughout the year. So I will go ahead and pass it on to Dr. Olivier to lead us in introductions.
Hey, good afternoon, everybody. I was out last month, so it's good to be back this month. I am the facilitator for this session, so I'll be trying to help mind the clock and keep us adhering to the agenda. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana. I work in my private practice called Bloom Mental Wellness, and it's great to see a bunch of returning faces and participants. So I'm going to ask the hub team to reintroduce themselves as usual. We try to have a hub team composed of a variety of different professions in mental health, and so I'm representing the psychiatry portion of that team. And also representing our nursing portion of the team is Ashley Hutchins. Do you want to introduce yourself?
Hi, everybody. I'm Ashley Hutchins. I'm a psychiatric nurse practitioner, and I also work at Bloom Mental Wellness here in Lafayette, Louisiana.
Thanks, Ashley. And representing our social work and therapy portion of this team is Lena today. Jody is out today. And you will also see Jen Bordelon in the background, kind of helping with our IT stuff. So she's there too. So welcome again. For the first part of this session, you can keep yourselves hidden and eat your lunches. But for the second part of the session, when we present the case, I encourage everybody to unmute yourselves, and that's the more interactive part. So you can also use the chat to ask questions and just engage in the session. So without further ado, I'm going to pass it over to Dr. Mayer. Please introduce yourself, and then you can take it away.
Perfect. Thank you so much, Dr. Olivier. So first off, I'd like to say thank you for inviting me to give this presentation. My name is Megan Mayer. I am a child psychiatrist with LSU in New Orleans, and I have a lot to cover, so we'll go ahead and get started. So we're going to talk about grief and loss in children and teens. This is a huge topic. There can be courses or books written about this. So this is just a little snippet, and I focused on death and dying. So we'll get started. Let's see. So we're going to briefly talk about the definition, then grief reactions in kids, developmental stages for understanding death, talking to kids about grief, and then helping kids cope. Okay. So bereavement, for definitions, is the fact of loss through death. Grief is the emotions associated with bereavement and that loss. Bereavement reactions are any psychological or physiological response to bereavement. And mourning is the social expression of the grief. So briefly, some statistics. And this is in the United States, so 5% of kids experience death of a parent. 90% of children experience death of a close family friend or family member, and 1.2 million kids, or there's 1.2 million early parental deaths in the United States. 400,000 children deaths occur annually, and the ratio gender of parental deaths is 2.5 father to 1 mother. So principles of grief. So this applies to adults really as well as children, but grief is a natural reaction to death. Every death is unique and experienced differently. And the grieving process is influenced by a multitude of different factors. And grief is ongoing. It's not just one point in time or the expectation that everything should be tidied up after 6 months. The length of time varies for different people. So children express grief differently. This is due to their lack of emotional vocabulary and ability to express themselves. So grief is then expressed through their behaviors. And I really like this term that I came across, grief bursts. So kids don't grieve as much or appear melancholy as much as, say, an adult would. That would be just sad all day for every day for a week. The kids, they might be sad and down, and then at the funeral, kind of after gathering, they might be running around with friends, and then they might be sad and crying around bedtime. So I think sometimes adults can interpret that as kids not feeling emotions or not feeling grief or sadness, but it's because it comes and goes and it's not linear like it is for adults. So factors affecting the grief response would be circumstances of the death. So if it's a suicide or if it's part of kind of a national disaster or some type of terrorist attack, that can make it even more difficult in the grieving process. Previous experiences of death affect how we or kids manage the current death. If there's participation in the dying process, such as a family member that's in hospice. And so knowing what's going to happen and going through that many months in advance. The quality or the level of the relationship with the deceased, the psychological or emotional maturity of the child, coping and adaptive strategies, as well as family and social support system. So we'll go through the different stages of bereavement. So acute grief reactions. And some of these apply to adults as well as kids. So there can be shock or apparent lack of feelings, and this can be a defense mechanism to help children detach from the immediate pain of the moment. There can be disbelief. So the kid asking the same questions over and over again about the death because it's so difficult to believe and accept. There's unreality, and I think adults in particular feel this, and then also this oscillation between the intrusive reality and the overwhelming emotions, and then denial of the event. So ranges of emotion can be expressed, sadness, anger, fearfulness, helplessness. And so, especially in younger kids, this can really come out as an acting out to reflect their frustration, their helplessness in a situation, and can be a way of them trying to exert some control over this situation. So there can be social withdrawal, sleep and appetite disturbances. And then one common thing that we see is regressive behaviors. So needing increased attention, cuddling, sleeping in the caregiver's bed, baby talk. I've even had some younger kids kind of return to crawling, different things of that nature, and that can be concerning for family members. Also somatic symptoms, trouble with concentration, bedwetting, nightmares. And then kids, younger kids, particularly in the kind of preschool to early elementary school, attribute things that happen around them to themselves. So they might feel if a person dies that it's because they did something wrong. And sometimes even it'll come up in frustration, say weeks ago, a kid was scolded by their grandfather, and then they thought briefly, oh, I wish he was dead. And then he dies several weeks later. They might attribute that wish to the actual death of the person. So as with adults, there can be difficulty with performing daily activities in an organized manner. Hostility and anger, especially towards relatives that are still alive, is commonly seen. And then even imitating the traits of the deceased, which can be unsettling for family members, adult family members. So intermediate grief reactions would be preoccupation with images of the deceased. Again, the somatic symptoms, wave of distress, yearning, work and school problems, irritability, and mood changes. And then long-term grief reactions could be a change or decrease in academic performance, internalizing and externalizing symptoms, somatic symptoms, and then it can really end up affecting their relationships at home as well as friendships. So the tasks of childhood bereavement are to cope with the immediate impact of the death, to mourn, and then to resume everyday normal activities. So there's three main concepts that kids have to grasp in order to understand the concept of death. So there's irreversibility, finality, inevitability, universality, and cessation of bodily function. So the irreversible is that this person isn't asleep. They're not going to wake up. This is final and not a temporary thing. Inevitability or universality being that all living things, every human, every plant, every animal will live and then die. And then cessation of bodily function. So lungs aren't working, heart's not working, and those things aren't going to suddenly turn back on. And then once you have those three concepts, then would move on to causation and a better understanding of the nature of death. So the developmental stages of understanding death, even infants and toddlers can sense, are very aware of their environment and can sense changes. So they may sense that adults are upset and there's a big change in routine, but have no understanding of the meaning of death. And then preschoolers may see death as reversible, and that this is the person is separated or is gone for a temporary period of time, and then they'll come back. And then they can even link events and magical thinking to the cause of death. There's a lot of material out there about 9/11 and the response of kids. So one example was if there was a plane crash, and then kids believe that it's not safe to go in the elevator more than one floor up because bad things could happen. Early elementary school ages, they're starting to comprehend the finality of death, and they can begin to realize that certain circumstances result in death. Like some people get cancer and they die from cancer. Some people get in really bad car accidents and that can result in death. But death is perceived as distant and something that happens to other people and not themselves or their circle. Middle schoolers are coming to or begin to understand that death is a final event and it leads to the ending of bodily functions, but they may not grasp the abstract concepts that people talk about, like the person's legacy or what they're leaving behind. And they experience a variety of emotions and feelings, and that can lead to some acting out or even some self-injurious behavior to deal with these intense emotions. In high school, most kids grasp the meaning and the circumstances of death. They may seek out others for comfort, or they may withdraw into themselves. And notably, teens with a history of depression, suicidal thoughts, and substance use are at risk for prolonged and serious grief reactions. And I think one thing to add is if kids have cognitive deficits or some type of intellectual disability, their understanding or appreciation of death will be delayed and not necessarily in line with these different stages. Grief education, which I guess this is part of, I think is not really something that we learn. It's pretty limited. I think I had some lectures on it as a resident in psychiatry, but we often just get thrown into situations and maybe we see the people that we're learning from interact with families about grief. But I think a lot of it is just we get thrown in and there's some trial and error. But I think the ability to speak with kids and families about grief is essential. So everyone is going to experience deaths around them and their own death. And so we want to make sure that when people are coming to our office, that if we know, say, that this 12-year-old grandmother recently died, we want to make sure that we're acknowledging that and we're asking questions about that. If we just focus on trouble with concentration and change in school grades, then we're kind of giving the message that grief isn't something to be discussed. It's not something to share. It's something that you keep to yourself, and that we don't really want to know much about your emotions. And then understandably, in order to recognize when grief can become maladaptive, have to understand what the normal responses can be. So the 5 C's that kids will worry about if when there is a death is, did I cause it? Can I catch it? Why can't I control or cure it? And then who's going to take care of me now? So we have to make sure that it's clear that the death is not their fault. As mentioned, younger kids can attribute what happens around them to themselves. We need to make sure that we're explaining things on the appropriate developmental level and then saying things like, your uncle had trouble with his lungs and breathing for years. The lungs stopped working, so he couldn't breathe. Want to make sure that you're giving concrete words and not saying things like he passed or because kids don't necessarily know what that mean, or he was called up to heaven. You want to say the words, died, not around, no longer living. And then if the kids ask more questions, you're young and healthy, your lungs work very well. You're not going to die from your lungs working. And then they kind of asked, how did this happen? Why can't I control it or cure it? People get sick and see doctors, but sometimes they can't get better. It's sad, but it's part of life. And then kids knowing who they're going to live with is important. I see lots of kids that are raised by their grandparents. And even if there's not a death, I think that oftentimes there's a worry if the grandparents are going back and forth between different doctor's appointments all the time, and they know their grandparents are sick. There's this question of what might happen, what's going to happen to me if they die. And so those are important things I think to discuss. One of the big questions that I get asked is, should the child attend the funeral? There's no hard rule. If the kid wants to go to the funeral and feels ready, they can. But you need to think about the kid's needs and what they're going to be exposed to at the funeral. So if they're going to be exposed to really dysregulated adults, people that are crying uncontrollably, could be very unsettling for a kid. But if they do go, you want to make sure that you're giving them some expectations. There's going to be a lot of crying. There'll probably be some songs and hymns played. We discuss the coffin with the dead body lying in the front. And then I think it's good to have a signal or a person that they can leave early with if it turns out that it's overwhelming for them. And as an alternative, if it's not right for the kid to go to the funeral, you could do kind of a private memorial at home. That can be writing letters or poems or planting a tree. And so it can be more intimate, but there still can be some expression of the grief in mourning, but just on a more private level. So talking to kids about death. So again, geared for their developmental level. And then children are very aware of the reactions of adults. So that doesn't mean that adults shouldn't express their own emotions and be able to feel and cry, but getting dysregulated or maybe saying things that shouldn't say, all of that is going to be seen and really absorbed by kids. So it's important to be honest, don't tell lies or any half-truths. Kids can find those out or see through those pretty quickly and then not understand why they can't be trusted with the truth. And then in dealing with a death, we're kind of preparing kids for what their experiences of death will be like in later life. And we want it to have a good experience or understanding of the healing process and prepare them for this in future life. Sometimes some kids won't have any questions and then we'll seem kind of disinterested, and that's okay. Eventually they'll probably have some questions, but that doesn't mean that the kid doesn't have feelings or doesn't love or miss that individual. So it can tell kids in a comfortable setting. It can be helpful to have a pet or comforting toy nearby. I think it's very important to prepare what you say in advance. And again, make sure that you're using like concrete words and avoiding euphemisms like she's in a better place. And then be prepared for them to ask some questions back. So an example would be, Grandma died. This makes me really sad. When someone dies, their body doesn't work and they can't eat or breathe any longer. You're not going to be able to see them again. And kids do know or sense when things are off. And if they're not being told, they often imagine the worst, or worse outcomes, that maybe more people are dying or that they're going to be dying. So it's important to be honest and upfront. And then the kids may take this story and change it a little bit for their friends or explain it differently, and that's okay. So we want to explain things to kids, but then give them a space to express their emotions and ask questions and kind of tell the adults what it is that they need. So we can't assume that every kid is going to have the same response. Oftentimes, you can see that with siblings that all have the same thing happen with the same individual and have very different responses. So you want to encourage them to share their feelings. We want to encourage them to ask clarifying questions. Why can't this body be fixed? Why does the body stop working? Um, and then talking a little bit more about expectations. So grief is a process. It's not a singular event. It doesn't end for everyone at a certain time. So we want to allow the kid to grieve in the manner that best suits them and not press the kids too early to return to normal activities. I think as adults, oftentimes we feel like we're supposed to have all the answers and we're supposed to have a nice contained truth and the answers to kids, but oftentimes we don't, and it's okay not to. But also be prepared when kids have questions about, am I going to die? Or are you going to die? And it can be good to start those discussions by talking about the way that most people die. So most people die from being very old or they have a really bad accident, and then can go into talking about these are the different ways that we try and stay safe by going to the doctor, wearing seatbelts, watching before crossing the street. And then when they ask about, well, mom or dad, are you going to die anytime soon? You don't want to lie, but be optimistic on I'm planning on living as long as possible. And if there's somebody that is slowly dying and you can anticipate the death, you can say it's going to be really tough and sad, but we're going to get through it together. So, in sum, we want adults to be concrete and provide the information to kids, but then talk less, listen more, and encourage questions. It can be important and very helpful for kids to have creative activities to help process their emotions, like drawing pictures or writing letters, planting a tree. And it can also be therapeutic for kids to play and have a lot of death that shows up in their play, and that's not a problematic thing. That is just the way that they process it. So we want to make sure that we're avoiding giving the wrong message of uncle went to sleep and didn't wake up, because we commonly hear that, and then the kids don't want to go to sleep because they fear they're going to die. Or God wanted uncle and took him home to heaven. That doesn't make sense. Or even the message of let's not cry about that, which is that emotions and feelings about death are not public and you need to deal with that on your own. So signs that more support may be needed if there's continued somatic symptoms, long-lasting trouble with sleep or appetite, a continued denial of the person's death, or statements of wishing for themselves to die. So big picture is that we should be talking about death regularly. The more individuals talk with kids about death, the more comfortable and prepared they are when something happens, and framing it as part of life. So kind of laying the groundwork for their ability to grieve and cope. So I think it can be helpful to kind of discuss this as part of a cycle of life. So if you see a dead butterfly on the windowsill, you can say, the butterfly was born and then lived and then the life ended. And you're framing this as part of a natural part of living as opposed to this big, scary, negative thing that happens at the end. And some people wish to discuss afterlife, and other people don't, and will frame it more as that person is always with you in your heart and in your mind. So that is my bit.
Awesome. Thank you, Dr. Mayer. Some great information.